Rub a lemon on your legs before bed. Watch what happens in 2 weeks. It's 10 at night. You pull off your shoes, sit on the edge of the bed, and your legs feel like they've been carrying sandbags all day. There's a dull ache behind your knees, a strange pulling feeling in the calves. And when you look down, there they are. Those blue, twisted lines snaking up your legs like roots breaking through old pavement. 1 in every 3 adults over 50 has them. Your doctor tells you it's just aging. That surgery is the only real fix. That's a lie. Tonight, I'm going to show you how rubbing half a fresh lemon on your legs before bed, done the right way, can shrink those veins in as little as 2 weeks, and why the pharmaceutical industry has been quietly copying this simple trick for the last 40 years. Now let me ask you something, and I want you to be honest. Is this you? If your legs throb after standing in the kitchen for 20 minutes, if you wake up at 3 in the morning with a cramp ripping through your calf, and you have to jump out of bed and stomp the floor just to stop the pain. If your ankles are swollen by the end of every single day, so swollen you can see the lines from your socks pressed into your skin. If you notice a dark blue vein on the back of your calf that wasn't there 5 years ago, and now there are 2, and now there are 5. If you've stopped wearing shorts, stopped wearing dresses, even stopped wearing capris because you don't want anyone to see. If you catch yourself turning sideways in the bathroom mirror, hoping the angle makes them less visible, and it doesn't. If the skin near your ankle has started to look brownish, almost bruised, and you know it's not a bruise, but nobody can explain what it is. You are not imagining it. You are not being dramatic. And you are most certainly not just getting old. This isn't your fault. Nobody told you this. Because the people who should have told you were the ones making money off your silence. Your veins are screaming for help. And they have been for a long time. Maybe years. And for the last 40 years, mainstream medicine has been telling you one of 2 things. Either buy those tight, uncomfortable compression stockings that squeeze the life out of your legs and don't fix a single thing, or sign up for a surgery that costs $3,000 per leg, leaves you bruised for weeks, and in a large number of cases just has to be repeated a few years later. There is a third way, and it's been sitting in your fruit bowl this whole time. Let me tell you what's really happening inside your legs right now. Your veins have tiny little valves. Think of them like one-way doors. Blood comes up from your feet, passes through a door, the door shuts so the blood can't fall back down. That's how blood climbs against gravity all day, every day, for 80 years. After the age of 40, something changes. Your body produces less and less collagen each decade. Collagen is the protein that builds everything strong in your body. Your skin, your joints, and yes, your vein walls. When collagen drops, those little one-way doors in your veins start to leak. Blood that should be going up to your heart starts pooling. The vein balloons out. And that's what you see on the surface, a varicose vein. Now here's the part that will make you angry. There is a medicine, a real prescription medicine, sold in pharmacies all over Europe and Latin America for the last 40 years. The pharmaceutical name is Daflon. In some countries it's called Detralex. Doctors prescribe it for exactly this condition. And do you know what it's made of? 90% diosmin, 10% hesperidin. 2 compounds, both flavonoids, both extracted from citrus peel, lemon peel, orange peel, the white pith right under the skin that you've been throwing in the trash your whole life. They took what nature gave us for free, ran it through a patent process, slapped a prescription label on it, and sell it back to you for $80 to $100 a bottle. I'm not saying the medicine doesn't work. It does. The studies are clear. A meta-analysis of 7 randomized clinical trials involving more than 1,600 patients with venous disease showed that these flavonoids significantly reduced leg pain, leg heaviness, swelling, cramps, and that itchy feeling under your skin. And in one recent clinical trial, 68% of patients reported a significant reduction in symptoms after just 2 weeks of taking those pills. 2 weeks, not 2 months, not 2 years, 2 weeks. Now stop and think about this. If the pill works in 2 weeks by sending a tiny amount of those flavonoids through your stomach, through your liver, through your bloodstream, all the way down to your legs, imagine what happens when you deliver those same compounds directly through the skin, right over the vein, where the problem actually is. No middleman, no liver filtering out most of the dose, no waiting. I'm saying you don't need the middleman. A fresh lemon applied correctly gives your body the same family of compounds, direct, undiluted, for 30 cents. But here's where most people go wrong. Drinking lemon water helps. It does. A little. But the real power is topical. On the skin. Rubbed in. At night. Let me explain why. Your skin is not a wall. It's a sponge. The skin over a varicose vein is actually thinner than the skin on the back of your hand because the swollen vein has stretched it out. And when you rub half a fresh lemon directly on that thin skin, 3 things happen at once. First, the cold of the fruit causes immediate vasoconstriction. The vein tightens. The swelling goes down within minutes. You will feel this the very first night. Second, the citric acid in the juice gently dissolves the dead, dry layer on the surface of your skin. Now the flavonoids, the hesperidin and the diosmin, don't just sit on top. They soak in. They reach the vein wall directly. This is called transdermal absorption. The pharmaceutical industry calls it drug delivery. I call it common sense. Third, the essential oils in the lemon peel, the same compounds that make lemons smell like lemons, are carried into the skin along with the juice. These oils have been shown to improve microcirculation. The tiny blood vessels underneath start flowing properly again. Now why at night? Why not morning? 2 reasons. First, your skin's repair cycle peaks between 10 in the evening and 2 in the morning. Anything you apply before bed works harder, deeper, longer. Second, lemon juice on skin in daylight makes you sun-sensitive. You could actually burn. So night is the only window where you get all the benefit and none of the risk. This is not a new discovery. Your grandmother probably did this. Her grandmother definitely did. They didn't know the word hesperidin. They didn't need to. They just knew it worked. All right? Here's exactly what to do. Write this down or watch this part again, because the details matter. 30 minutes before bed, go into your kitchen and get 1 fresh lemon. Organic if you can find it, because the peel is where most of the compounds live and you don't want pesticides on your legs. If not organic, wash it well with water and a little vinegar. Sit down on your bed or a comfortable chair. Prop your legs up on a pillow so your feet are higher than your hips. Stay like that for 5 full minutes. Just breathe. This drains the blood that's been pooling in your legs all day and prepares the vein walls to absorb what you're about to give them. Don't skip this step. This is the first mistake people make. After 5 minutes, cut the lemon in half. Take one half. Squeeze it slightly so the juice starts to surface on the cut side. Then rub the cut side of the lemon directly on your skin, right over the visible veins. And here is the second place people go wrong. The direction matters. Always stroke upward, toward your heart. Never downward. Your veins carry blood up, against gravity, and your massage has to go with that flow, not against it. Start at your ankle, stroke up to your knee. Then from your knee, stroke up to your thigh. Firm, slow, confident strokes. 5 full minutes per leg. If the lemon runs dry, just squeeze it again and keep going. When you're done, do not wash it off. I repeat, do not wash it off. Let the juice air dry on your skin for about 10 minutes. While it dries, lie back, prop your legs up one more time, and close your eyes. Then before you get into bed, put on a pair of clean cotton socks. This protects your sheets from the juice and keeps your feet warm during absorption overnight. Go to sleep. In the morning, rinse your legs in the shower with warm water. This part is important. You must rinse before going outside in daylight. Lemon residue on skin plus sunlight equals a chemical burn. So rinse. Every morning. That's it. That's the whole ritual. 5 minutes of prep, 5 minutes per leg, 10 minutes of drying, and sleep. Total cost per night. Less than 50 cents. Let me give you 3 warnings. 1. Do not use bottled lemon juice. Ever. The essential oils are gone. The vitamin C is oxidized. The flavonoids are dead. You need a fresh, whole lemon. 2. If you have an open wound, a rash, or severely cracked skin on the area, wait until it heals. Citric acid on broken skin stings badly. 3. This is not for pregnant women without talking to your doctor first. I'm not your doctor, but I'll tell you what the science is saying. And the science says pregnancy changes how your veins respond to everything. Here is what you should expect. After night number 1, the heaviness in your legs will feel lighter. Not gone, lighter. You will sleep better. Some people say they stop waking up with that 3 in the morning calf cramp after just 3 nights. After 7 nights, the skin around the veins will feel tighter, less puffy. The itching starts to fade. At the 2-week mark, this is where things get interesting. The smaller, thinner surface veins, the ones we call spider veins, will start to get paler. Not vanish. Paler, like someone turned down the volume. At 30 days, the larger, deeper varicose veins will feel softer to the touch, less rope-like. The brownish discoloration on your ankles starts to lift. While you do this ritual, help your veins during the day too. Cut back on salt. Table salt holds water in your tissues and makes your legs heavier by the hour. And walk, even 15 minutes. Your calf muscle is what we call the second heart of your body, pumping blood upward with every step you take. If you sit a lot, stand up every hour, and move your ankles in circles for 1 minute. That alone makes a huge difference. But understand something. These things support the ritual. They don't replace it. The lemon at night is the engine. Everything else is fuel. So let me bring this home. For decades, you've been told varicose veins are just old age, that they're permanent, that if you want them gone, you'd better save up for surgery. That's a lie. And now you know why. Varicose veins are not a sentence. They are a nutritional and mechanical deficiency in your vein walls. A deficiency that your grandmother's grandmother already knew how to fix, using something that grows on a tree in almost every warm country in the world. You don't need permission. You don't need a prescription. You don't need $3,000 and 2 weeks of recovery. You need 10 minutes a night, 1 lemon, and 30 days. Here's my challenge. I want you to take a photo of your legs tonight. A close-up, good lighting with a date on it. Don't be embarrassed. Nobody has to see it, but you. Just take it. Then, starting tomorrow night, do the ritual. Every single night. No skipping. No, I'll start Monday. Just tonight. Half a lemon. 5 minutes of elevation. 5 minutes per leg. Upward strokes only. Cotton socks. Sleep. Rinse in the morning. Do that for 30 nights. On the 31st day, take another photo, same spot, same light. Compare. If you do not see a visible difference, if your legs do not feel lighter, if the cramps have not reduced, if the skin is not looking better, I will be shocked, because the science is solid, the method is old, and the results are real. But you have to do it. Your veins are not going to fix themselves. Tomorrow night, half a lemon, 5 minutes per leg, upward strokes, 30 days. Your legs will thank you. Your mirror will thank you. Your independence will thank you.